Please, Russell, take it away.
All right, I'm going to share my slides in a moment, but I do hope that the closed captioning capture, if you choose to use it, captures it, because sometimes I've seen closed captioning butcher what people are saying or change it into something could be funny even. So
it might be funny, but this one's better than most I've seen so far.
So. Okay, good. Yeah. I'm glad. Well, the other thing is about the types of housing that you just mentioned, which I see in the below where we are right now. We are going to talk about independent living, permanent supportive housing, residential rehabilitation, transitional housing. I'll just say this now. You're not going to see slides on transitional housing or assisted living. Transitional housing is for persons who are homeless going into a temporary housing situation as they attempt to get them to permanent housing or the other more appropriate housing for them. And assisted living, although my agency at the state is doing more with this, assisted living is, as most of us would think, it's not nursing homes, but assisted living is where persons need help with their daily activities of living, ADLs. So, hopefully we're doing more with that because we're finding that in our residential programs, people are aging out and are needing that level of care. So we're moving towards that as well. At any rate, I'm going to go ahead and get started. I'm going to now share my screen, and I look forward to I'm trying to save quite some time at the end here to do some answers to your questions. So here we go, and I'm going to do it with the full screen. And I'm hoping everybody can hear me and see this on their screen. So there, of course, is the title, and just as not a disclaimer, but just to give you the essence of what we're trying to do at the Maryland Department of Health, and particularly at the Behavioral Health Administration, our mission and vision statement. Now, I'm not going to sit there and read over some slides. I will read over because it'll be important, but other slides like this, the PowerPoint presentation, or at least in a PDF format, will be available through, I think, the NAMI website or some such by the end of the conference. So you'll be able to get copies of this, which is always one of the questions that people usually say. So just to let you know, the Behavioral Health Administration is what was previously the Mental Hygiene Administration. Everybody wondered what they meant by hygiene in that sense, but still was the mental health. And then the Alcohol and Drug Abuse Administration. Pretty much we've gotten rid of the word abuse. It's now substance use, and that covers everything. So anyway, the Behavioral Health Administration is these two agencies came together, it's two different administrations, and now that's better. That is behavioral health, which is for mental health and substance use. Just so you know, our local players, we are the state entity, but the core service agencies, the local addiction authorities, and more frequently, the local behavioral health authorities are in each county of the state of Maryland. So they are the local on the ground partners with us that are helping to know all of the local resources, and we rely heavily on them. So then, and then the Administrative Service Organization, which you may have heard, does the service authorization claims and payments, and that the current one is Optum Maryland. We've had a couple different ones over the last 20 plus years. Okay. The areas we're going to be talking about today: residential programs and permanent housing. So the residential programs, like residential rehabilitation, I know a lot about that because that's one of the things that's real important to us right now. And I'm working with state hospitals, but this is also for persons from the community to be referred to. And now, so for certified recovery residences, which is part of the Maryland Recovery Network, this, of course, even though we're merged, this probably has a higher focus on substance use in that sense of recovery. Recovery is a broader term, as everyone I think knows. That means recovering your life from whatever disabilities or dysfunctions or disorders you may have. So these programs focus on, the recovery residences focus on persons with substance use disorders, but then also on top of that, they may have a co-occurring disorder. So they may have dual diagnosis, we used to call it. Permanent housing, on the other hand, is where a person has their own lease and they live on their own. So, and there's different types of this, and these are programs that the state of Maryland are involved in. Continuum of care, it used to be called Shelter Plus Care, permanent supportive housing, which is what I really want to talk about the most, and housing first, not so much the concept, because the concept is broad and there's a lot of literature on that, but it's which is primarily about getting a person into housing first and then bringing the supports to them, which we know from a lot of the work that's done in terms of getting people into independent living, is that there's a lot of barriers to getting into housing with landlords and expectations and background checks and all that stuff. And we'll talk about all that too. So moving on, residential rehabilitation. And I won't spend a lot of time on this, but I do know a lot about it. We have almost, as you can see, 2,500 beds or serve that many persons statewide. It's 2 different levels of care, general level, intensive level. I'll describe those in a moment. You can see there's almost twice as many intensives as there are general. And even though some programs are in multiple counties, there's 47 different program sites. So some jurisdictions like Baltimore City, Baltimore County, Montgomery County, Prince George's County, Anne Arundel County, the big ones, are going to have multiple RRP providers. And also, I meant to say, I'm going to use acronyms. I'm going to hopefully say it out the first time. And then after that, hopefully you can hear me with the acronym. But there are at least this many programs statewide in different sites. Anyway, RRP provides this home-like setting with supportive residential environment. Staff are there. The staff do not live in the house, but staff come in and out of the house. It promotes individuals' ability to engage and participate in community and all activities, and enables individuals to develop the daily living skills they need to move, to be as independent as possible, and hopefully move out into their own housing at some point. Residential rehab also is to access is by submitting an application to the local authority. It has to go to the CSA, which is the Mental Health Authority, or the LBHA, which is both, as I said before, the local Behavioral Health Authority. And it goes to the county of residency. So if a person is from Carroll County, they would submit to the Carroll County LBHA. And that's, and then if they could, though, they can ask for it to go to another county, but they have to go through their county of origin's local authority. Eligibility is determined through the BHA priority population. And this starts with a list of diagnoses, which is most of the serious mental illnesses, the schizophrenia, schizoaffective disorders, the various bipolar disorders, major depressive disorders, and a handful of other disorders, because this is who's being served in these programs, persons with the most serious disorders. And the medical necessity criteria, the MNC, well, I don't have that acronym up there, but no big deal, is also applied by the Administrative Service Organization to make sure that persons meet that eligibility standard to come into the program, and then every 6 months before they do a concurrent review. And most people do come into residential rehab and stay for a while. There's no time limit on it. Some people are there for a lot of years. Other people are there for a year or two. Okay, the local authorities, they review the applications, track the vacancies, maintain any waiting lists if that's necessary, and refer applications when beds become available. And they can also refer them to other counties when need be. This is a link. It's not a hyperlink, as you can see, it's not lit up, but it's a cut and paste link that can go into a browser and find the application on the BHA, Behavioral Health Administration website. This is in the process of being updated. This is a 2020 version of this, and I've recently updated it to the 2022 version. Okay, and like I said earlier, the 2 levels of care, general and intensive, is a matter of how much staff time you're getting. So the general level of care, the minimum is, this is based on what they have to do to submit for billing for that month, is 13 visits, face-to-face visits in a month. But they're more likely in the house at least every other day, sometimes every day, because they're checking to make sure people are taking medications, things like that. Intensive level care, they have a certain number of encounters they must do as well, but they have to be in the house every day and in a minimum 40 hours a week. Both levels of care have on-call staffing 24 hours a day. But one thing that people are looking for is that overnight awake on site, which is commonly called the 24/7 housing or residential rehab, where a staff person's always there. This is not as frequent and does exist, but is, as you can imagine, is quite expensive. But the thing is this: it is needed in various situations, persons with various more serious um, uh, circumstances. Okay, we have some specialty ORP programs for young adults, and these are the counties they're in. For persons that have developmental disability and mental health issues in these counties. This is strictly a co-occurring type disorder treatment. This is an evidence-based practice. ITCOD being this term, integrated treatment for co-occurring disorders. It's only in 2 of the counties. Deaf and hard of hearing is in a few counties, and then older adult, which these days we used to call it geriatric. Of course, that terminology is passé. But older adult is also for persons, it could be younger, but have medical conditions. So even though there's handicap accessibility or wheelchair accessibility throughout the system, not a lot of it, but in every county there is some. Older adult that housing tends to always have the accessibility, complete accessibility for physical disability. Okay, now this is new to my presentation, and I'm going to try and do as best I can, but there's numerous slides here that were given to me by a colleague and my supervisor to put into the presentation to let you know that there is substance use and co-occurring recovery residences, residential programming. So recovery residence is alcohol-free, drug-free housing for individuals with either substance use related or co-occurring. And these are the statutes. You'll see the COMAR regulation and the various statutes that brought it into effect. It's the recovery to be licensed under this is voluntary. There are other recovery residences that are not licensed per se, but they exist because in the substance use world, I think there's always need for the housing, and sometimes the housing is not long term, but we've all mostly know about halfway houses and quarterway houses and things of that nature. But this is recovery housing, is recovery residences are it's not that it's new, but it is that there is a statute overseeing it with licensure. That's the new part. It's been around since 2016, but that's still relatively new, and it's been rolling out since, and we increased the number of providers statewide. So the credentialing and all this goes on. This is not my forte, so I'm just going to try and get through it. And you can, and at the end, you'll see my colleague Patricia Canyeso, her contact information. And if this is what, let's say for yourself, a loved one, or somebody within one of your programs is in need, you believe is in need of, then you'll be able to reach out to Patricia and she'll be able to help. But this is the certification requirements, and I'm not going to belabor all this, but it's all here, and like I said, it'll be on the NAMI. We'll make available the whole PowerPoint, so more of this will come out. And there's different levels of support. Recovery residence means peer-run recovery, and recovery residence, staff monitor recovery residence. These are level 1, level 2, and then there's level 3 and level 4. Staff recovery, staff are involved. This is the certified license. Okay, so anyway, I think it just keeps getting a higher level of staffing at each of the different levels of the recovery residences. This is where you can find them in these counties, which is 17 of the, there's 24 counties. Well, there's 23 counties in Baltimore City, but there's also, of course, for us, we've lumped together Mid-Shore, which of course you see Kent here, and Worcester and Wycomico and Somerset are on their own down the southern end of the lower shore. But on the middle shore, Kent, Queen Anne's, Dorchester, Talbot, and and Caroline are all grouped together for their local behavioral health authority, just for your information. Maryland Recovery Net, this goes on. It's still about the state care coordination entities. This is like case management for persons with substance use issues or co-occurring. The focus being, of course, they have to have a substance use issue. And Recovery Net service recipients receive this care coordination and can access it, and includes client support and recovery housing. There's and of course the goal, I believe, is always still moving more and more towards independence and self-sufficiency. And the eligibility criteria for persons going into this, only adults 18 and above have to have a substance use disorder. And let's see, I wonder if they have anything about Medicaid. No, it doesn't look like it. Okay, at least it's a low income, verifying income at or below 200% of poverty level. And yet more. It's also going through the ASO now. So state coordinators in each jurisdiction make referrals to the Maryland Recovery Net staff in order to be approved, certified, and then get funded. Okay, now continuum of care, the old, this is another type of housing altogether, and has generally been focused on persons who are homeless and who have serious mental illness and can also have co-occurring. But it focuses more on the mental illness, but in conjunction with the homelessness. So in Maryland, it's funded by HUD, and it is, but oversight for about 300 of these units is done through BHA, through Behavioral Health Administration. And of course, HUD is Housing and Urban Development. It's federal. So we do have federal partners, of course. These counties, Montgomery, Garrett, Howard, and the city, they all have their own contracts with HUD. So they do not go through BHA. So that's really the difference. But pretty much this kind of housing exists everywhere. So it's grant funded, provides rental assistance, which is subsidies for permanent supportive housing for individuals and families. And if it's a family, it has to have an adult member who has the mental illness and or co-occurring disorder and has experienced homelessness. So more information, eligibility, you can talk with the person at the CSA or the LBHA of the person's county of origin. All right, now, permanent supportive housing. I'm not sure how many sips of water I'm going to need to take here to keep talking at this rate, but I do want to make sure we get through it and have some time at the end. So I'm going to try and keep an eye on my time. But permanent supportive housing is persons who are in the public behavioral health system, or our larger thing, where the person themselves becomes the leaseholder. So they may have been in residential programs, they may not, but they are somebody who has most likely has a disability based on their mental health, and they may have physical disability as well. And the housing units are subsidized or affordable, because subsidized under like HUD definitions means that you're only going to ever pay 30% of your income. So if you got $100, you pay 30. If you get $1,000, you pay 300, and that's all that you pay for rent. And then whoever is subsidizing it, a lot of times HUD, will pay the difference to the landlord, because the landlord is going to get the full amount. Services are available but not required, and so that means it's voluntary. So they may need or not need psychiatric rehab programs, PRP, or mental health case management, or mobile treatment, which is also the evidence-based practice version is assertive community treatment, or ACT. And those are the supports that are usually given. We're going to get more into the housing, but this stems from the Olmstead Act, which from the U.S. Supreme Court, where persons all are meant to be living in as integrated in community settings as possible. So living in some group homes or some larger group homes it's not very integrated. Or if it's in a building where everybody has the same kind of, that is not integrated whatsoever. So and of course, hospitals, state hospitals, a lot of people are there together, but we're really trying to move towards persons living as much independently in the community as possible. So it's also an evidence-based practice, permanent supportive housing. This would be like the Cadillac of permanent supportive housing, the SAMHSA toolkit. And if you were to look at this, and this seems like it is a hyperlink, as I put my cursor over it, it lights up. This one here will show you, and it's free. It's a toolkit online. I don't think they're sending out any more hard copies of it, but it really goes through every aspect of it. We're going to just cover a few of the key elements of it because these are essential qualities of living in permanent supportive housing, which is a lot like independent living. I mean, it's intended to be like that, but you are eligible for supports. So tenants have their own lease, their own name. They have all the same rights as any tenant, any other landlord-tenant law. Leases do not have to have special provisions, just like anybody else. Support services are available and accessible, but are voluntary, not required. When you're in a residential program, you pretty much have to be involved in going to the clinic and have to be involved, maybe it's the day program or something, but we're doing something viable during the day. But with PSH, permanent supportive housing, you don't have to. You can just stay home, but it's usually good for people to get out and do something depending on how they define productive for themselves. Rules within the housing are the same as anybody without a disability. So this is still just, it's to be treated like any other person in the community. Housing is not time limited. Lease is renewable at the tenant or owner's option. So like anyone else, landlords can end leases at the end of a lease period. But if it's renewable, it's renewable. So it's not time limited. Prior to moving into permanent supportive housing, tenants are asked about their housing preferences, and we'll talk a little more about that. To go through the same range of choices that anyone else can in the income level that they're at in the same housing market. So if a person has SSI, which we know is only a little over $800 now, or SSDI, which might be higher, it's limited in terms of income. But when you're talking about getting a subsidy and you only have to pay, let's say, 30% of your income, then, you're able to afford other housing or better housing. But there are some limits, at least with HUD, with how they figure that in different neighborhoods. And that's a little more complicated than I can get into at this time. Housing is affordable with tenants paying no more than 30% of their household income to rent and basic utilities. So that's good. If you have $1,000 income, only $300 goes to rent and utilities. And the rest of it, you still have to be a pretty good budgeting wizard to figure out how to get through the rest of the month. But still, if that's all you have to pay for rent and utilities, you're doing pretty good. Housing's integrated. It's best in scattered site locations around the community in order to live in communities or buildings that have a majority of persons who do not have any disability. And then I think this might be the end of the key elements. Tenants have a choice about the support services, range of support services, whether it's ACT or case management or whatnot. It's their choice. Again, tenants needs change over time so that they can receive a more intensive or less intensive service or no service for a period of time and then get back in needing supports. Support services are designed to promote recovery, help tenants choose and acquire and keep housing. And finally, the provision of housing and support services are distinct. So the service and the housing piece need to be separate. So property management and support services, it could be done by the same agency, but they have to be separate so that the person you're calling for your maintenance of the house or you're paying your rent to is a completely separate entity from anybody who might be helping you as a case manager, just to make sure that they do not overlap and there's not really a conflict of interest there. Okay. Not to belabor it all too much, but approach methods are there's project-based rental assistance, sponsor-based rental assistance and tenant-based rental assistance. Tenant-based is what we usually think of with housing choice vouchers, or what used to be called Section 8, where a person has a voucher and they can go wherever, any landlord that'll take it, which we know that there's some limitations and a lot of NIMBY stuff goes on in the world. But to be able to go somewhere and have a landlord take it, and they have their own voucher, it stays with them. Sponsor based is when a nonprofit agency is creating the housing and for persons that can come into it. And project based is which is one of the larger things with the HUD 811 projects that we're working on now. Housing subsidies are tied to a particular unit. So if there is a development, an apartment development, which has, and a lot of new ones that may have only a certain amount of the units have this project-based rental assistance. So it's never more than 25%. I'll explain that in a moment, but to keep it integrated. But the rest of it could be affordable, but persons that are in project-based rental assistance, the assistance stays with that house. It's not portable. They can't take it with them if they were to leave and move to another county or another city in the same county. They can't take it with them. It only goes with that building. So just that those are the different types of that. And then single site and scattered site, and we're much more about the scattered site as opposed to single site. There are some, I've heard of some veteran groups that have some preference to having all veterans to be near each other. But for the most part, what people have in common is not anything that they're necessarily needing to be together for. So scattered site, just integrating the community, is the preferred mode. Now, an assessment for a person to be able to move into this type of housing, it needs to really be person-centered. Person-centered, of course, is a large concept, and there's all sorts of evidence-based trainings on that. But when a case manager, somebody who's going to assist the person in finding their own permanent supportive housing, their own independent living, they need to meet with the person. They need to go over what the strengths, assets, preferences, needs, challenges. They need to sit down and do a full assessment with them about and educate them on the housing options that exist and develop strategies for accessing those programs. But I think that sometimes the assessment needs to look at what is it that you really got to have. So if you need to live in you can't live near where there's liquor stores. You don't want to live anywhere near those because you'd be tempted. You want to live near a dog park. You've got to have your pet with you. So you can't move to a place that won't allow pets. You have to have certain modern appliances, or it has to have air conditioning at least. Various things that people have preferences for that need to be listed. Also, and we'll go into that as we hit the challenges, but I think that it's the assessments I've seen are also good when they ask them the hard-hitting questions like, what about your background? It's like, do you have any legal problems in your background, so that when we go to sign a lease or sign up and they run a credit check, are you going to be able to get through it? So the case manager, in doing the assessment to begin with, should be finding out all the relevant facets of the person that they're helping. There are various different copies of these assessments. I've seen different ones used, and they should be used by the case manager or the helper, the person who is going to be working with the individuals trying to get into this housing, because it's not that it's impossible to do alone, but it's not intended to be done alone. The common challenges. Okay. Well, the first one there, lack of affordable housing in Maryland. I think we could all know about that. Maryland, and right now, it's just getting worse, as I think most people know. Housing is expensive, and in Maryland it is. And the difference between renting and owning, it's still all high. Social Security income. Oh, I've got to change that. Okay. Social Security income, I believe it's now $841. And I missed that in my slides. Okay, I'm making a note of that. SSI 794 goes to 8. I think it's 841. Maybe somebody here knows, but I'm pretty sure it has gone up. It's over $800. Okay, criminal. But what I'm saying is SSI is still a very low amount of money. It's below the federal poverty level. So if you have SSI, and this isn't a benefits um, session, but to know the difference between SSI and SSDI. SSI is a person who really has not worked much in their life, and they're still going to be able to get this benefit. Whereas SSDI, you've paid into, and you're going to get disability insurance from the Social Security Administration. Criminal background checks, that's one we'll talk a little more about. Credit and rental histories. If you've ever been evicted and you must go on a computer somewhere, credit checks, and we all know those free credit check things. Utility arrearages, which, you've gotten behind. If you owe Potomac or BG&E or Delmarva, if you owe one of the big ones back money, you're going to have a hard time getting into a new apartment where you have to have your own account with them, with whatever the current one is, and they talk to each other, so they know. So and needed documentation. So this can be a barrier. Social Security card, the Social Security award letter, photo ID, birth certificate, income verification, and of course, housing waiting list. So this is a sad list, but this is a real list of things that stand in the way of people getting in their own housing. Okay, documentation is just cut and dry. So here's like a single page on it. These are things that need to be worked on by that case manager who's working with the person sooner than later. So getting the birth certificate. This is a link for where birth certificates in any well, this is Maryland, but the vital statistics. But there's other links we have where you can find the vital statistics administration for every state of the country. And of course, some people are born outside this country, obviously, and they come here and it's harder for them to get the birth certificate, but they're going to need it. So that takes a little more effort. Having a valid photo ID. You don't need to be a driver, but your passport's good, or a state ID, or a driver's license, which is a state ID. The real ID, this has got some new requirements. So this has been in effect since right before the pandemic hit. So look into the real ID because there's new hoops you have to jump through for the Motor Vehicle Administration. Social Security card, and for each person that lives in the house. Proof of citizenship if you are not what is your status? Because some people are, they have a green card. Some people have lost their green card. Some people never had one. Some people are on a visa. So there's lots of different statuses of citizenship. And a lot of that times means also whether or not you could get Social Security or not. Or medical assistance or Medicare or not. Child custody. Unfortunately, you have to show whether or not the child that would be living with you is yours, and divorce decrees if you've been married. So this is a lot of paperwork for people to get together and have to prove who they are, how old they are, whether they can drive. No, whether they're a citizen, and whether the children and whether they actually is a spouse or not. Okay, so identifying these challenges, credit, criminal background, and personal rental history. These are three of the big key ones of looking at background checks that landlords look at. So I know there's no great easy solution to these, but there is some thoughts about it. Credit issues. Of course, you can obtain, for starters, find out where your credit is, what your credit rating is now. Accessing legal services, legal aid, or I believe there's more. I have a whole list of resources at the end of the presentation. And identifying community resources to assist with paying outstanding debts if there's something, depending on how much it is. There's also contacting, if it's with the landlord, it might be that you defaulted on a car, or it could be almost anything, but credit cards, but the previous landlord's a creditor, to see if they'll waive certain things or if you can consolidate payments. determining if a disability or medical issue impacted the ability to maintain the good credit. If that's the case, and we're going to talk about this, reasonable accommodations, we're going to talk a little bit about that. That's an important thing. Let me see how I'm doing on time here. This goes, when does this go till?
We've still got time. We're on for another, I can't do math in my head, of course. I think we're on till 35 past or 25 past. Let me check.
It's over at 4:35.
4:35. Yeah.
Okay.
Yeah, I was going to come hit you up at about 10 minutes of.
Okay, good.
Good reminder.
Good.
So.
Right. Okay. So credit issue is one thing. Then you got criminal background. This is one of the ones that's a tougher thing. So case managers should ask the person and work with them about whether or not they have a criminal record, and if it's a lesser crime, can they expunge it, and submitting reasonable accommodation requests when possible. And we'll talk about those separately. So having a trusting relationship with the case manager and helping them to open up about what their past was like, checking Maryland Judiciary Case Search. We have the link at the end. This you can look up yourself, but not that you need to do that, but you can look up the person you're working with to see whether or not they have any open warrants, if they've been charged with anything, if they've been anyway. So it's good to look this up before, because some landlords will look it up, and they have ways of finding out about it from other states. This is just from Maryland, but still, you want to look for that. Anyway, if it's in Maryland, you want to remove open warrants, seek legal counsel if necessary, trying to help the person understand the rules around the housing, determine if a change in the medical or health, if they were not on medication, they were between doctors, they became symptomatic, that and had a change in their behavior which caused them to commit a crime. This does happen, and we work with plenty of persons who are in our state facilities that are on not criminally responsible, but they actually did commit the crime. Sport commitment to acceptance of rehab and other sport services, and assist with connecting to community services, resources. But I think reasonable accommodations can help with that. Okay, overcoming rental history. This is if you've been evicted, you've had issues with paying rent on time, can't get along with the neighbors, or maintain a safe environment. Understanding tenant obligations. So this is understanding these things, being honest with the case manager to talk about what may be a stumbling block as you look for a new house, new place to live. Determining, again, whether that had any impact on it, and helping the person to write an explanation of the circumstances. Okay, and then reaching out to previous landlords to try and explain it, or try to get a positive reference. Maybe a previous landlord where you had a good experience, to try and get a positive reference. The system connecting the services and challenge. Okay, so anyway, like I said, there's no easy answer to these things: a rental history, criminal background, and credit issues. But the case managers, we do have more extensive training on that for those to learn more about the things, and they learn a lot from each other as well. Okay, reasonable accommodation. Now, I'll say this, the difference between this and reasonable modification. Reasonable modification is where we need to put in a ramp for somebody who has a wheelchair. I mean, we're going to change the structure of the building to accommodate. Okay, reasonable accommodation versus modification is a change or exception or adjustment to a rule, policy, practice, or a service. It must be necessary to have a person with a disability have an equal opportunity to enjoy the dwelling. Okay, sounds good. Reasonable accommodations require a housing provider to do more. They must make changes in rules and procedures and policies. So a lot of them will say no pets, right? And others will say nobody with a criminal background. Okay, well, if you're applying for housing and it has a criminal background, these screening things could screen you out. A reasonable accommodation is for them to acknowledge the person has a disability, a mental health disability, And it was because they were hearing voices that they stole that car or did something criminal, and they either did time or they paid the price for that, or whatever that was. They actually still, now they're in treatment. Now they are living a life free of crime, and they are no longer, that's no longer an issue. So can't they lift the policy? And this is a reasonable accommodation to change their policy of not accepting somebody with bad credit because when they were manic, they spent a lot of money and they couldn't pay it back, and so they had bad credit. Or when they were psychotic, they committed a crime, and it was because they weren't on medication, and they have a disability. And then explaining that, the person has to write their own letter. But then even beyond that, they get support from either doctors, therapists, case managers can write other letters that support them for that. We have actually done this where persons who have background things that were denied by a landlord, then the landlord was able to, because the landlord needs to take into account reasonable accommodations for a person who has a disability. And this is a policy change. It doesn't cost them money. They don't have to build a ramp. This is allowing someone in who may have had issues in the past that are no longer issues. Okay. Anyway, and I'm trying to say it's not impossible. It has happened. I've seen it happen. Household members, live-in aides. Okay, live-in aid, having somebody who's not related to you live in the house to take care of you. This is a lot of times for physical disabilities. Service or emotional support animals, or of course, seeing eye dog. Of course, we all know that. But service or emotional support animals are very much can be accepted with a reasonable accommodation with a landlord who says no pets. And then, of course, the neighbors are going to go, why do they have a pet and I can't? But the thing is this, it is because they have a disability and they require it. Searching for housing. Time, they always say, well, 2 months is all you get. It's like, well, they can say, well, look, the person needs another 2 months. It's getting extensions and things like that as well. Okay. If you need one, you must ask for it. But a lot of people just don't know that they can ask for it. So it has to go in writing to the property owner, person you would rent from. You have to share that you have a disability. You don't have to go into the details of it, but you have to share that you do have a disability, because that's like a key word. Describe what you want changed, what you need to have changed. In most cases, the property owner has the right to ask for proof, but you need a reasonable accommodation. Your medical provider, case manager, can write a letter on your behalf for that. The My Sample letter for requesting a reasonable accommodation. I used to hand these out at the when we did the conference live, but I'll show you where it is in the link. You can find one in the thing that comes up later. And always keep a copy of the letter you say. Don't send the original and then they say, well, we never got it, and you don't have a copy to back it up. Okay, now this is just further moving ahead. Say you get through all these hurdles. Now you're going to still gear up, and there's things that can still become problematic. So preparing to move, planning, identifying who will help you, because some people don't have anybody. They have a minimal support system, where their support system is their therapist and doctor, and the therapist and doctor aren't going to help you move. You're not coming out on Saturday with a pickup truck. Okay, they don't do that. So connecting with everybody who will be involved. Okay, planning, if you have people that are helpers that will help you, identifying who can do what, and who will be involved in the transition or the move. We have had issues where people are moving from county to county, and so they're changing pharmacies, they're changing everything of it. They're changing doctors. You can go back to your old place, but it's along a lot of transportation. So getting linked to a new providers of things and learning out where the grocery store is and everything else. There's a lot that goes into moving, especially if you're going to, let's say they're taking advantage of one of the Section 8, 11 housing in a different county, they're going to need to have somebody refer them to services in that county if they're used to getting them in their home county. And moving prep, so more of that. So when is the actual move date? Who's going to help you get you to the new residence? Who will help you pack your stuff up? The local pharmacy medication order prior to the move, so you have enough in case it's longer to get you situated with the new pharmacy. Medical appointments in the new area. If you need a checking and savings account, setting that up. Do you have the money for the security deposit? And there's other ways. There's other ways. The local behavioral health authorities have some funding for that as well. Good tenancy. This is real basic. Paying rent on time, maintaining the unit, the apartment you live in, engaging in friendly neighbor relationships, or at least not bothering them. Complying with the terms of the lease, communicating with the property manager, and understanding the responsibilities. Of course, you understand your rights too, but understand your responsibilities. Persons that have always been living at somebody else's house or in a residential program are not used to a lot of these things. They're not used to being a leaseholder. So and these are the kind of things that a lot of us have been living with most of our lives. But for some folks, even at any age in life, this might still be new. So it's important to take all these things into account. This booklet is where that the reasonable accommodation letter is. My own friend. I'm going to jump ahead. This is what it looks like, and it's a handbook for people with disabilities becoming a tenant and staying housed. This woman here has got showing off her keys, and she has this is like 2 or 3 houses here, but one of these is hers, and the Maryland Partnership for Affordable Housing, which is part of what we're in. You'll hear about that in a second. At any rate, this is the link, and this is this book is actually it's got to be an inch thick, and has a lot of good stuff in it. And I highly recommend it if you're helping anybody or if you need it for yourself to move in, and all of the nuance, how to do a budget, how to do almost everything to become your own tenant and be successful at it. Okay, here I'm going to try and breeze through. What's that?
Oh, sure. Thanks for sharing that. Where could someone get a copy of that?
Right here.
At that link. Okay. By the way, these are all in the chat for anyone who wants to click on that. Go ahead and check on the chat. Our tech guy has been awesome about putting stuff in there. I was just popping in to say we've got about 10 minutes left.
Okay, good. I'm going to try and zoom
leave
here.
Time for questions.
We have these housing initiatives in Weinberg, Housing First Pilot Project, and Section 811.
Yep, we still got 10 minutes. You're good.
Okay, I know, but okay. So, if you guys are answering some of the questions for me, that's great. With the links, very good. But I wanted to at least be available for a few minutes at the end.
Awesome.
Weinberg Initiative, they're benevolent foundation, and they help with building houses, and then for the next 20 or 30 years, it's a built-in subsidy. So anyway, there's of course you go through it, and there's that to get into it, it's non-elderly. When I say that, it means it's 18 to 62 years old. So I mean, I already can't get into it because I'm beyond that, but it has to also be at an income level. I'm not trying to get into the Weinberg Initiative, but I'm just saying it exists, and there's eligibility includes the ability for tenants to pay. This is the same 30% like everything else. Housing First Pilot Project. These are just in Baltimore City, Montgomery, and Prince George's counties. It's only 72 units, but it is something where you go through the local authority of each of these, and if they and it's for persons. It's designed for persons who were homeless and are being housed, and they might have a wide variety of issues, but they really try to promote that the person gets housed first and foremost, and then they also will stay with them and supply them with the supported services as well. So there's more here, and like I said, I just want to try and get through some of this. Eligibility is that you're either going through the SOAR project, which was another presentation done today by one of my colleagues, but that's where you get Social Security benefits, and a person coming out of a state hospital or somebody transitioning out of RRP in any of those jurisdictions. and it has to be income at 50% below the area median income. This is the big one that we've worked on with the Section 811 PRA. I'm trying to think what the PRA stands for again, but I said it earlier. Anyway, the Maryland Partnership of Affordable Housing is a group that includes BHA, it includes Department of Health and Community Development, Money Follows the Person, Department of Disabilities, all these groups, Disability Rights Maryland, Independence Now. So anyway, all these groups are part of this, and I've been a part of it for the 9 years I've been at BHA. But it began in 2011. I started in 2013, but it is Maryland Department of Health, and then it's also the Department of Housing and Community Development, and also the Department of Disabilities, and the Centers for Independent Living, consumer organizations, and housing developers. These are the places where a person goes to get onto the registry to find out if you're eligible for it, and also if you are on a waiting list. So there was a $20 million initially, another $6 million, and there's been another. Actually, this was the first two, and then this just recently came, and in 2020. So for another 100 units, which have not come up yet. So ultimately it's going to be 400 units. DHCD works with housing developers. Maryland Maryland Department of Disability runs the eligibility and the wait list, and Maryland Department of Health, where we work for DDA, BHA, and others are providing the individuals who will be able to access this. So there's 400 permanent supportive housing units. That's it. Project-based rental assistance. Project rental. Okay, that's what the PRA stands for. Okay, it's located in multifamily housing developments. These are like large, nice, new, brand new. I've seen some of these as well. Housing developments where no more than 25% of anybody of the units are for persons with disabilities, and usually it's like 10 or 15%, but it maxes out possibly at 25%. Eligible applicants, they call this the a NED is the non-elderly disabled. So you have to have a disability, between 18 and 62 at the time of leasing. You could stay beyond 62, but you have to have Medicaid and have to be below 30% of AMI, which is average median income. It includes SSI level. And again, it's 30% because this is all underwritten by HUD. And the priority populations for this were persons institutionalized trying to get out of nursing homes, persons at risk going into nursing homes, persons moving into independent living. And here's our residential rehab programs at BHA, and then brain injury waiver, assisted living, and DDA group homes and assisted living. And the homelessness defined by the HARF Act. This is also a priority. Persons who are homeless, and this defined this way. So these are all relevant things. But it's kind of like on a scale. So to say that we don't get as many people coming out of nursing homes, but that is the priority nursing homes. And then this has been maybe, more than a third, but then there's been a whole lot of people who are coming from our programs as well, who are going into this housing, and it's very nice. And then we have had homeless people go in as well. Okay, that's pretty much it. The resources I have here is a few pages of this. I've checked all these links, so they all do work. So SSA, HUD, the credit thing, expungement of nuisance crimes, judiciary case search, Disability Rights Maryland, Public Housing Authority, Locator. Now it gets colorful. Housing Choice Voucher Guidebook. Forget Craigslist. This is just an example. Go to places where you can get things for free. There was one I had called Baltimore's Free Store, but there are things out there in your neighborhoods where if you're looking for furniture and stuff, I don't know that I would get a roommate through it, but you're on your own. Weinberg Initiative, HUD, food stamps, affordable housing. This is something you can look up more on. housing search, social serve, Fair Housing Act, reasonable accommodations. This is HUD's take on it, MVA. And then here we go. This is me, where I work, and my information. And this is my colleague. She goes by Trish, but Patricia Cagneso, and she is over the MDRN and MCOR, the stuff I was talking about at the beginning. Okay. I can leave that up there, but what I really want to do is move back to seeing the screen. Let me see if I can what it looks like if I do this now. Yeah, is that okay? Yeah, I figured there might be some questions or something, but how's it going, Helen?
It's going great. It doesn't look like we have any questions, but let me just check again and see if anyone popped anything in there. Looks like one of the links we threw in might be broken, but
or this link doesn't look like it's all blue.
Oh, link number 4. Link number 4 worked for me. We have someone, Kimberly was saying link number 4 didn't work, but it worked for me. Okay. Strange. That was the birth certificate request link, but well, we don't seem to have any questions. I guess I'm curious, since you've obviously been in this field for quite some time, what would you say is the most frustrating thing that you're hoping will get fixed about the way this process works right now, or doesn't work, I guess?
Well, which process? Because
right.
Because I mean, my work right now, as much as I promote permanent supportive housing and independent living and all the things that people want to get to, it is still, we're working with court systems and the state hospitals and people who want supervision of persons that are coming out of those, and that has taken up a great bit of my time now at work. Although we're hiring somebody, a new position coming on will be for RP PSH, Residential Rehab Program, Permanent Supportive Housing, and that's a transition coordinator, try and help people who have moved up the levels of care, intensive, the general, to move out, to create flow inside so that people can I want to make sure that people can get that
we did fix, we got the link thing fixed. There is a question about how are the waiting lists these days?
Okay, well, okay, if you're talking about, let's say, Section 8 housing choice vouchers, which is called nowadays, in Prince George's County or Baltimore City, forget it, it's closed. Okay, those kind of waiting lists are closed. Okay, and those are probably the ones at public housing authorities, which are key players in the HUD subsidy business. And HUD is moving away from vouchers further. They're not expanding that as programs. They're moving more towards these like HUD 811, where they're creating housing that has subsidy built in, and it's nice housing, but you have to live in this housing to get the subsidy. Mm-hmm. So it has to meet your needs of like where it is. So like the very first, we were doing this statewide, and we have been, and it's everywhere now. But at the beginning, we were doing it. And the first one they had was in Harford County, and it was in Hartford. So Hartford has challenges of its own, but it's for persons in Baltimore City. Hartford County seemed like the country, and they didn't know, and so we had somebody move from Baltimore City to outside of Bel Air somewhere. It was not Bel Air. It was one of the other townships in Hartford County. And they were like lost. They did, and they would have to wait for somebody to drive them back into the city.
Yeah, I was going to say
things like that.
If you're not working with great public transit.
No, right. But we have that everywhere. So I mean, only in the major urban zones do we have the transportation everywhere. No, but all this housing has to be. It's a rule by HUD, has to be somewhere within transportation. So. Not Uber, Lyft. I mean, I'm talking some kind of bus line, and or there has to be some availability. Even this one did have that, but it was just that the person felt like the fish out of water, being in a new county. So, And I think that the reasonable accommodations, there's a whole training that's done just on that. That takes a few hours. That is exceptional, done by one of the ladies from one of the women persons, excuse me, from Maryland Disability Law Center. Now they're called Disability Rights Maryland. So they do a really good presentation on that, and they're part of our Maryland Partnership for Affordable Housing. I think that this is what's key and what a lot of people related to NAMI want to know about. Others do need or want to know about residential rehab for their family members. So those programs are across the state, and some of those have some waiting lists to get into. And of course, we don't want your loved ones to go into a state facility, Springfield, Spring Grove, or any of the other ones, but persons in those hospitals are the first priority because we have got to move people out of those hospitals. I know we closed Crownsville years and years ago, and I'm not seeing any possibility of them closing another one anytime soon, not my lifetime. But I think that they will. They're trying to make sure that they're not expanding the number of beds. And right now, there's a law that says that if persons who are in court or in jail, who the judges said they must be evaluated for mental illness, they have to get into a state hospital within 10 days. And that isn't happening because there's too many. And let's face it, the pandemic has created huge challenges. And I would say some of it is legal, that people are, I don't know, it seems like there's more and more crime being committed. I can't tell you anything about that or why that's happening.
A lot of factors there.
But persons who are in jail are getting into state hospitals. And then the other thing is that the staff at our residential programs, besides just, people who are getting sick, congregate living settings, which is what all these are, people don't want to work at those anymore. So we're having a hard time keeping staffing at a lot of the places. So, efforts are going through this. We're doing workforce development. We got a plan for that as well. There's lots of things happening to address all the issues that are going on right now. And we have BHA even has a permanent supportive housing initiative where we have grant dollars that we're using for subsidies, but it's limited, but it's still, we try and take advantage of what's already out there, what is HUD funded and what anybody else is funding. There's still programs like Main Street Housing, which is statewide, Housing Unlimited, which is in Montgomery County, and other ones where you can get on their waiting list, individual waiting lists, and they have subsidized housing, and you have to have some form of income, and it can be SSI, SSDI. They'll work with you, and there's housing is always just a bottom line. People got to have some place to live. We know our continuum is we work with persons who are completely homeless on the street, persons who are homeless in shelters, and we pretty much don't have to worry about people who own their own homes. But everything in between, from all the different types of programs that people are going through, it really is key to have a place to, hang your hat or head at night,
Well,
So,
and I think it's hard too, because, what you're describing is this, the spectrum of need. And, from the folks that come into the classes, their 19-year-old is living at home, right? So not homeless, but it's not going to work, right? It's not a housing situation that's going to work for anybody long-term, both from a just health and safety standpoint. And so I think it's hard when you have families whose kids, adult children really need to live somewhere else for everyone's well-being. But they get in line, right? There's an acute need for a lot of people who literally are on the streets. So it's just very hard to meet all of that. I guess if we're looking at silver linings, the pandemic kind of shone a light on that in a way that wasn't the case before. So we've gone over, but we already, we weren't.
Yeah, it's Friday at the end of the day.
It's Friday. We're still hanging in there.
If anybody's still listening, thank you. I hope you learned something. And you are going to post the slides somewhere, right?
Yeah. So actually, I don't know if we still have Marquise. Mark?
Yes. So the session was recorded, so everybody could see. Will be able to see the slides and be able to view the recording later.
Perfect. That's awesome. Where can
Yeah,
people go to find that? Is that going to be in sessions or in?
Hold on,
There's a
give me 1 second.
replay thing at the bottom here. Maybe that's.
I didn't even think about that. The recording. I guess everybody was okay with that.
Yeah, people are told at the beginning, and it's right there at the top of the screen and whatnot.
Yeah, I saw that. But,
but the participants aren't recorded at all.
Okay.
So like you and I are, but the participants aren't.
So the recording would be available either sometime next week or by November.
Awesome.
Okay, and how about the just the PowerPoint?
Well, we if you want to share your PowerPoint with anybody who asks,
No, I thought that's why I sent it in. It used to be, maybe this was old school, but it wasn't that long ago, where that was the only thing that was shared, and that was put on the NAMI Maryland website so people could tap into it. I
bet you if people email connection@namimd.org, which is the email they keep putting out for every session, connection@namimd.org, I'll bet you we can get that out to people. So anyone who wants it, if you email them and ask.
Because what I was really getting at was my my contact information and Patricia's contact information.
And all the links that are in there. So yeah.
Yeah, and that too as well. Yeah, of course.
Yeah, absolutely. Well, thank you so much. I really appreciate hearing this. This is super helpful.